Dear viewers, wherever you are, hello and welcome to this new episode of your program, Spectra. The headlines since the end of last winter. As the world witnessed COVID-19, or the novel coronavirus, start as a disease in the city of Wuhan in China, then evolve into an epidemic that hit different parts of China, and then at the end of last March, it was declared by the World Health Organization as an international pandemic. This pandemic did not only affect people's health per se, but it affected all aspects of life: economic, social, and psychological. Work and education switched to online, sales are being done online, and socially and psychologically, big difference in human life with social distancing that greatly affected not only the physical distancing, but also the psychological one too. Nowadays, there's a lot of talk about vaccines coming out, drugs coming out. Some are acceptable, some are not. And lately, here in Ontario, they switched to partial closure of many areas, especially recreational, facilities like sports areas, sports arenas, gyms, also like cafes, restaurants, nightclubs and bars, etc., while keeping others open. They closed in the region of Peel, in the Toronto area, but kept it open in others. So what's really going on? Like, were the decisions taken the proper ones? Are we going on the right track? And what is the way out? How much time do we need? What do we need to do? What is true and what is a myth? Because unfortunately now, there's a big mixture. People are really confused, the huge overlap between fact and myth. Tonight, I'm really delighted to be accompanied by Dr. WA2EL Zarka, who's a specialist in immune system diseases. And he is the best one to shed light on this topic. Dr. WA2EL, thank you very much for joining us tonight.
It's my pleasure, Mr. Mohammed. Thank you so much for having me tonight.
It's always a pleasure having you, as always. And to start off very briefly, from your point of view, as much as possible, how long will we stay with the corona pandemic? Are we talking days, month, or are we talking years? Is there any way to estimate the remaining time for us to come out of this great predicament that we're owing?
Actually, nobody can predict when it will be over. We are not magicians to say that it will be over within a year, 6 months, 2 weeks. But from getting back to the history of the other pandemics that happened, especially the one with the Spanish flu that happened in the 1918, actually it took a year from spring to spring. So as we've started in spring of 2020, I predict it to last till the spring of 2021, having the same measures, and we are also tracking the same waves of the Spanish flu. We are now in the second wave, so if we say that there will be a third wave in winter, so by next spring, everything will be over, hopefully.
So some people are saying here, okay, so this is not the first pandemic that has hit the world, and there's a very interesting phenomenon actually, is that almost towards the 20s of every century, there is a big pandemic that hits the world. So in 1720, in 1820, 1920, and now in 2020. Or almost, so it's like 19 or 18, around the 20s. There is this something that reoccurs every 100 years. But did people before react in the same way? Like with the Spanish flu, which was also a very hard pandemic that hit the world in the beginning or in the first quarter of the 20th century. Did the world really react in the same way? Were there calls for closing up everything? Or was it completely different?
Actually, it was completely different. I believe the social media has played a major role in enlarging this pandemic and putting it in the headlines and scaring people and getting a lot of myths out of it. So the news has been moving so fast with the internet and with the social media. So the measures has been also exaggerated because of that. All the countries and even on a smaller scale, with the people, with the families, everybody got scared and they took drastic measures regarding the COVID, and it's a huge pandemic and a lot of people are dying, and they have reacted in such scared way from governments, from people. They were all reacting not as a normal disease that might happen. And they have enlarged the scope of measures and they have enlarged the scope of fear. So the closures, I think they were exaggerated by that and by the fear of people. So the governments have reacted drastically, also closing everything. The lockdown was there and the people were lost their jobs and everybody was stayed at home for like 2 or 3 months in most of the countries globally. I believe the Spanish flu wasn't like that at all. Everything was normal and the people has reacted normally, but also the deaths at that time were much more than what we are seeing nowadays with the COVID. So it's neither closing nor opening are the right decisions. It's something in between. You don't have to get scared and avoid everything. And at the same time, you don't have to be living a normal life. So get protected with social distancing, avoid communicating with who's infected, avoid communicating with those who are coming from abroad recently. Also, if you're sick, stay at home. This is something I believe this is the wisest decision to be taken.
Okay, so from what you said, Notter, so you think that like this hype and this incredible talk about it for being on the headlines so much, and it's being blown out of proportion, it's mostly because of social media, who have really took it out of its normal scale and they blew it up extremely. And so right now we've seen some kind of contradictory policies here. And I would like you as an immunologist to tell us from a scientific point of view. So we've seen before, you know, like before this closure that happened, they said that, okay, we'll open restaurants and cafes, but they should close at midnight and not stay afterwards. Is this something logical? Again, now they've closed in the Peel region, but they're open in Halton region. So, for instance, someone like myself, I live in Mississauga, and I live in the western part of Mississauga, so Oakville is closer to me than eastern Mississauga. I can always go to Oakville. And same thing goes for people who live in Toronto and Etobicoke. They can still go to other cities that belong to other regions. Is it logical to like limit the time? Like, is time limitations to say you'll be open until that time and not after that? Will that help in any way reduce the coronavirus? And again, closing some areas while opening others, while transportation is still open. Does this make sense? Open, like close restaurants and cafes, recreational areas, but open schools with little children who cannot be easily controlled. Also open places of worship. Are these logical, scientifically based decisions, or is there a lot of economic and political matters at stake here? Is it in a democratic country where, like, we have a responsible government that is always being assessed and evaluated by the people? Are these decisions bearing in mind the coming elections, the voters' points of view, or are they purely scientific?
Of course, they are not scientific at all, because it's either closing or opening. If you want to prevent a disease or prevent a pandemic, you have to close totally. You're not supposed to leave these facilities open, especially schools, and close the restaurants. Population-wise, those who are going to schools are way more than those going to restaurants or pubs or night clubs. And closing at 12 also doesn't make any sense to me, because the virus doesn't sleep at night and wake in the morning, and so you have to close at night and open in the morning normally. So it doesn't make any sense to me. But actually speaking, it is a political decision with the pressure under the government, with the increased number of cases daily that is happening. So they are under pressure, and they are between two blades of a knife, that the economy is just recovering from the first wave, and we have to continue with opening, or shall we close and let the economy down again, and whoever is suffering, let him die. But in the same time, it is wiser to close those gatherings of people that you can control, like schools, with the small kids who are not aware of wearing the mask all the time, of social distancing, and playing with each other closely, with the adults who can control that. So it's wiser to close the schools than closing the pubs or closing the restaurants to people who are aware of what they are doing. Regarding the closure of after midnight, I think this has something to do with those who are drinking, who might be connected to drinking after midnight in pubs and in nightclubs, and so they are not aware of social distancing, so they might get closer to each other, hug each other, or so. So that might be the rationale behind closing at midnight. But other than that, it doesn't make any sense to me, and it's not scientific at all.
So, like you said, it like there's no real rationale behind it. It doesn't really make any sense to because even if, like, yeah, in some places where some people might get drunk, but there are many other places where people are sober, completely sober and awake, like restaurants that do not serve alcohol, or like cafes, and they still apply the same thing to. So there might be suspicion of, again, being politically correct, in order to avoid pressure from one pressure group than the other, to look as fair as possible to everyone. Now, on the other hand, like, there is a lot of talk about vaccines that are out, like the Russian vaccine and other vaccines that are being produced. and also some medications. But the Russian vaccine, although it produced antibodies and T cells, which are the marks of the success of a vaccine, and yet the FDA, the Food and Drug Administration of North America, refused to admit it, refused to give it authorization. And they said, we will not try it on apes, let alone people. Is this a scientifically correct declaration by the FDA, or is it a political or economic one? Is there like a matter of competition, economic competition between, producers of drugs, or is there a political competition, or is it scientifically correct?
It is scientifically correct, I believe, banning this vaccine because it doesn't pass through the scientific procedures that should be followed by creating a new medicine or a new vaccine. That has to be clinically tried in 3 phases. And this vaccine, I believe, has passed only phase 1 of the clinical trials. It has been tested only on humans, and it's not followed up for 6 months at least to prove its both efficacy and least side effects. It should have taken more time to prove and to do the trials than what has the Russian vaccine followed. In the Western countries, they are strictly following these rules and these scientific measures of having the phases of trial, and this should be also followed by Russia and China for getting this vaccine to light. They should continue their studies and should prove their efficacy and safety for this vaccine.
So like you said, like there's no real rationale behind it. It doesn't really make any sense to, because even if in some places where some people might, get drunk, but there are many other places where people are sober, completely sober and awake, like restaurants that do not, serve alcohol, or like cafes, and they still apply the same thing to. So there might be suspicion of, again, being politically correct, in order to avoid pressure from one pressure group than the other, to look as fair as possible to everyone. Now, on the other hand, there is a lot of talk about vaccines that are out, like the Russian vaccine and other vaccines that are being produced, and also some medications. But the Russian vaccine, although it produced antibodies and T cells, which are the marks of the success of a vaccine, and yet the FDA, the Food and Drug Administration of North America, refused to admit it, refused to give it authorization. And they said, we will not try it on apes, let alone people. Is this a scientifically correct declaration by the FDA, or is it a political or economic one? Is there like a matter of competition, economic competition between, producers of drugs, or is there a political competition, or is it scientifically correct?
Of course, if it's something that is that effective, that cures people in 3 or 4 days, that should be available to everybody. And they should declare what they have given to the president, so that people start asking for this medication for them, and those who are in need should take and be provided with the same medication. This is fair. This is he's a human, and the other sick people are humans as well. So I believe this was a political game, and this guy wasn't even infected with the COVID, because I didn't hear of people who got infected with the COVID, even with influenza, who got cured in 3 or 4 days. So it's a game from the start, and everything was fake. And he was moving in the hospital freely since day one, and he was not being kept in his room and away from people. And from the start, it was something, a propaganda, political propaganda, and that's it. But if they are having truly this medicine, they should declare it, and they should say what they have given to the president, and it should be accessible to everybody to get it and get cured if they need it. But I believe it's not.
So you think, like, if he really even got it again, it's something for it's first class service. It's not something that's available for the layman. It's just something for the president. On the other hand, another big impediment or obstacle in delivering the vaccine whenever it's out, like, the United States is working on one, Canada's working on one, Britain's working on one, Germany's working on one. So anyways, even if the vaccine is out, we just heard in the vice presidential debate between, the vice presidents of both the Republican and, the Democratic candidate in the United States, we heard Harris, who is the vice president for the Democratic nominee. She said that even if there's a vaccine that is out and it is, approved by the Trump administration, I will not take it, and I do not advise the administration of this vaccine to anyone. So, how can we overcome this psychological obstacle that has started to grow up by time because of social media and psychological propaganda again, that it's not good enough, there is like sort of a conspiracy, or again, like many people say, vaccines can cause many diseases for children. For instance, something like, things that affect, their mental capabilities of the little children as well, because of it having aluminum and things like that. From your point of view as an immunologist and from your knowledge about previous vaccines that we take today easily, how is it able to convince everyone? What is the best psychological practice for people to overcome this psychological barrier against taking the vaccine? Everyone says, I don't want to be the first one. So how can we overcome that?
Vaccines nowadays are so essential because the disease is so crippling, and it's fatal as well. So whenever the vaccine is available for a disease that is introduced to the public, it is, as I said, has passed through a lot of testing, a lot of clinical trials, a lot of approvals from the government, being safe and effective. So as long as these vaccines has passed through all these trials and have been approved by Health Canada, these vaccines are safe to take, and they are not harmful, because by the end of the day, these companies who produce the vaccine wants to keep their reputation and keep their money, because if somebody has proven that he has got a disease or has been affected by this vaccine in whatever source, he will get a lot of penalties will be paid by the company, and so nobody can jeopardize his reputation and jeopardize the incomes from selling such a vaccine that is doubtful or might cause a disease or might be sued for. So I believe whatever approved will be safe, effective, and everybody should take. And whatever this lady who has declared that whatever Trump's campaign will give as a vaccine, I won't take. This is also a political propaganda. Whatever will be declared is not by Trump, it's not by his party, it's by the FDA, and it will approve it or disapprove it according to the measures and testing that has been passed and accepted with the phases of clinical trial and with the safety measures and with the efficacy as well, being a good vaccine that prevents disease.
Is it also fair that some people say that vaccines can cause some problems to children? For instance, something like autism. Autism is one of the things that affect children, and one of the reasons some people say for autism is taking vaccines. And so is that true? Like, is there a 100% safe vaccine, or there's always a risk with any vaccine?
There's nothing safe. No, there's nothing 100% safe. Even the medications that we are taking, from antibiotics to analgesics to non-steroidal anti-inflammatories to antihypertensive drugs, all drugs has its own side effects and has its risks. This includes also and implements on vaccines. These vaccines has some side effects that might affect some people with, like you said, the postulation of having autism after vaccination, but it's not 100% that all the people who are taking these vaccines get autism. So there's a probability or there's a chance of getting the disease from a medication or getting a disease from vaccination, but also it's like a side effect, any side effect from a medication. And the danger that it prevents from having a disease that might be fatal is way less than the benefit from getting the vaccine and preventing such disease.
Okay, again, with the production of the vaccine, it will take a very long time, and even with the production of a medication, it'll take a very long time to produce, and to produce, like to have a mass production to satisfy all the needs around the world, and then to deliver it will take a very long time. So some people have been suggesting, why don't we resort to herd immunity? And first of all, before we go deeper, can you give a simplified explanation of what is herd immunity exactly?
Herd immunity is like gathering a group of people to get such a disease. Like in some Eastern countries, like in Egypt or India or so, when they get the measles, they used to gather the family members and put them all together to get the disease in early life years, so that they will avoid getting it later in life with all the complications. This is the same like herd immunity. And it is preventing or getting the disease while in good health, then after being elder and getting the complications. But this happens in non-fatal diseases, or it might be possible in non-fatal diseases. But in such disease like the COVID, it's not wise to do so, because its fatality even being so small, but like infecting 7 billion people with a disease that has a fatality of 1% or even 0.5%, so you'll get 70 million people that might die out of disease because of the herd immunity. And this is not a small number, or it's not a small figure to put people at risk of getting all the population having immunity from a disease that has a fatality of 1% or even 0.5%. So you're risking the life of people for immunization, but it's not wise. Let like the measures that has been taken of flattening the curve, so getting the people having infection by whatever mean, but with preventing the disease from happening to all the community that might burden the health services, and will not be able to save lives with huge numbers of people getting infected and getting need of being put on a respirator or entering the intensive care unit or being attended by a physician 24/7. No health system, wherever in the world, that could carry this responsibility of having such a huge number of people getting infected at one time. And UK has declared by its prime minister at the start of the pandemic that they will follow this herd immunity, and they have declined it after a couple of days, that their health system couldn't keep up with the huge numbers that have been infected.
So, isn't it fair to say the same thing about the flu or influenza? Like, it's a disease that has been there with us for a long time, and there are some shots, yeah, but actually around the world, the percentage of people who take the flu shots around the world are very, very minimal, really. And mostly we depend on herd immunity. And at the same time, like there's a mortality rate also with the flu. It kills some people. It's a tiny percentage, just like COVID-19, but we use herd immunity. So why can't we apply the same thing with COVID-19? What is the difference between the flu and COVID-19, really?
COVID-19 is highly infective, and the recent studies by the CDC has declared that it is airborne, not droplet infection. So airborne diseases are widely spread, and they might infect a lot of people in such a small scale of time. Not like the influenza, it is infective, but the method of infection is droplet infection. So, and it's not as infective as the COVID-19, so it might be controlled easy, and the number of infected people are way less than the COVID, so it could follow the herd immunity method of getting people immunized or getting people, whoever needs care, it will be available for him because of the numbers are not as much like in COVID. So, and also vaccination, and there is a treatment as well for the influenza, so it's a totally different model than the COVID. And your health system might carry as much infected people with influenza than it might carry as much infected people with COVID.
Okay, so now you said it's airborne, so it's carried by air. It's not only droplet infection, so it doesn't only come from coughing, like saliva or sneezing, mucus only, or touching a space that has some mucus or saliva on. It's carried by air. So can we deduce from that complete closure, even for a long period, is not the right solution to cure us from COVID-19? Is what I'm saying scientifically correct?
Yeah, of course, of course. Closing, a lot of countries has closed and has locked down their people totally at home, except for 1 or 2 hours a day, as far as I can remember. And this didn't prevent the disease at all. And they are having huge number from the start up till today, with all the closures, with all the preventive measures that they have taken. And this proves that the disease is airborne. It's not like droplet infection, as people who got infected are those who were not communicating with other infected people, but did get the disease from whichever source. They are out for getting their food, they are out for getting their medicine, they are out for getting an essential travel or essential whatever. But during the total closure or the total lockdown, it didn't prevent the disease. And it happened in a lot of countries, and we've seen huge numbers, and it's not preventive. And whatever was happening in Canada, it wasn't closed, only they have closed some businesses, they have closed the gatherings, but the people were free to move and free to go in and out. And we didn't see that huge numbers of infections like we have seen in these countries, in spite of getting a lockdown.
Some people make this comparison, like places of worship, churches, mosques, temples, and so on. They're all open, there's social distancing, of course. You have to register before going and wear a mask and, like, bring your own prayer gear if needed. Okay, but they're still open. While on the other hand, schools are closed. And here in Ontario, when Doug Ford gives us the update, the daily update of what's going on with COVID-19, while he's giving the speech, you can read messages that are, spontaneous messages, and they're sent to him live, of many parents asking to close the schools. So opening places of worship, but still opening schools, aren't you really putting the lives of teachers and parents of little children and their grandparents at risk here? Is this sort of a political decision, really? Because this might be the worst time, actually, for any government in the world, especially in democratic countries. Because here you're in double jeopardy. You're between the hammer and the anvil. Like you're choosing between economy, which means putting food on the table. You cannot survive without food. And, you cannot get food without money, which means you need to work. At the same time, on the other hand, you're putting health at risk, which means life itself. So closing schools might mean, okay, if you close the school, the child will stay at home, then the parents cannot go to work to earn their living. So is it a scientifically correct thing to keep places of worship open and, and schools? Is that fine? Or is it more of a political decision in order not to get any pressure from here or there, from any pressure group based on economy or faith?
Of course, it's a political decision. It has nothing to do with science. It's either opening or closing. And also, the schools are more dangerous to be open than closing the restaurants or worship areas, because the children, the small ones, especially those who are in primary schools or in KG, are not aware of how to wear masks, how to keep the masks on, social distancing. They are playing with each other, getting close to each other, hugging each other. And you can control them at the 8 hours. During the 8 hours, they are still in school. But for those who are aware, those adult people, the adult community who goes to restaurants, who goes to worship areas, they are more responsible and they are more aware of their duties and obligations of wearing the mask all the time, having their prayer gear, as you said, and keeping a social distance and coming in lines and getting out in lines as well. So they are more mature and can follow the restrictions and follow their obligations that they have to, other than the young generations that they are not so committed of following these rules. So it's basically a political decision, and the government has been under pressure with the increased number of cases happening during these days, and they believe that they should do something, and they have sacrificed the restaurants.
Last but not least, Dr. WA2EL, you said that this virus is sort of a very smart virus that keeps morphing, keeps changing itself. It maneuvers a lot. It adapts itself. Again, it's like a chameleon. A chameleon that can change itself all the time to combat. So the symptoms are not uniform. They keep changing. Like the structure of the virus keeps changing. So we are in a battle for quite a while. Like hopefully. Vaccines will be out in 6 more months or so. So until we find a way to, prevent ourselves from this disease by taking a vaccine, or to cure it if we have it through a medicine. What is the list of do's and don'ts, or what is your advice to decision makers on one hand and to people on the other hand for the next few months?
The decision makers, I say you've been doing very well during the previous couple of months, and you've flattened the curve and you've preventing the loss of a lot of lives by taking the wise measures that should be taken. You've supported the families, giving them subsidies and avoiding them from bankruptcy and putting food at their tables. And at the same time, you've supported the health workers and supported the communities. So keep up what you were doing and don't be overpushed by the media of reclosing and banning and avoiding. And you've put a lot of measures that protects people. So keep up the good work. And for those people, I say you were responsible and you've kept yourself away from the infection. You've kept social distancing. You've been wearing masks all the time or most of the time while outside your houses and at work. And you should keep up taking all these measures and don't get bored of these measures. And we have passed a lot of hard times and we should still keep what we were doing and stay safe and avoid the gatherings and avoid communicating with unnecessary gatherings or parties or so. So it is wise of keeping what we were doing and keep what's right. And keep yourself safe. Don't stay at home, but stay safe, and you know the measures that you should take. And God save everybody.
Dr. WA2EL Zarka, the specialist in immune system diseases, thank you very much for being with us tonight, for giving us, this great pieces of information. And to our dear viewers, if I may share a piece of advice like for me and you together, let's resort to science, let's resort to specialists. Let's not just take our words from the grapevine, from rumors, from word of mouth and social media. Let's resort to specialists. If you want to know something, ask a specialist, someone who's really accredited, someone who's certified. Don't just go and ask any other person. And because this can really put us in a lot of jeopardy. And this can really lengthen the time required for us to get rid of this ferocious pandemic that has hit us, that has really affected the social fabric of societies. So we've waited for a long time, few months to go. Let's hold tight because, there's nothing as precious as health. If we lose our health, we lose everything. So, don't put your health at risk for just a few hours of fun, really. A few hours of fun and you'll be sorry for a very long time. Or just, hold yourself for a while, couple of months, and then you can enjoy the rest of your life. Dear listeners and viewers, thank you very much for being with us tonight. Until we meet again, please stay safe. Thank you very much.